If you're over 60 or care for someone who is, you need to stop scrolling and pay close attention. Because what I'm about to share could change the way you look at your medicine cabinet forever. Every day, millions of seniors take a pill they believe is helping them. It's prescribed, it seems harmless, and it might even make them feel better in the short term. But underneath that comfort could be a slow, silent assault on the heart. As a heart surgeon with over 35 years of experience, I've seen far too many older patients walk into my office, confused, fatigued, short of breath, only to realize the root cause isn't aging or even heart disease. It's the very pills they trust to keep them alive. And the most dangerous part, most of these medications are common, found in everyday homes, taken without question. This is not about fear. This is about survival. This is about elderly wisdom meeting medical truth. And it's a wake-up call to everyone who believes that if it comes in a small bottle from the pharmacy, it must be safe. Seniors deserve to live strong, clear-headed, and heart-healthy lives. But it starts with awareness. So before you take your next pill, ask yourself this: do I really know what it's doing to my heart? Today I'll reveal the 7 common pills that may be slowly weakening senior hearts across the country. Some are meant for sleep, others for pain, blood pressure, or even allergy. But all of them share one dangerous potential: to silently harm your heart muscle, disrupt rhythm, raise blood pressure, or shorten your life. And stay with me until the end, because pill 1 is the most widely used and also the most dangerous, especially if you're over 60. This is Elderly Reflections, where senior health, life lessons from the elderly, and inspiration meet medical reality. If you care about your loved ones, or if you're living in your own chapter of later life, hit that like button, subscribe, and turn on the bell icon. We bring you weekly truths that protect the body and uplift the soul. We begin with a type of medication almost every senior has used at some point in their life. Let's start with one of the most trusted over-the-counter medications, NSAIDs, non-steroidal anti-inflammatory drugs. Think ibuprofen, naproxen, or even brand names like Advil or Aleve. Used by seniors for joint pain, arthritis, or back pain, these pills are often taken daily without a second thought. But here's the problem. For the aging heart, NSAIDs are like a slow-burning fuse. These medications raise blood pressure, retain fluid, and increase the workload on your heart. And that's only the beginning. Take the case of Robert, a 74-year-old retiree from Michigan. He started taking naproxen for arthritis in his knees. Within 6 months, he found himself out of breath doing simple chores. By the time he saw me, he was in the early stages of heart failure, and neither he nor his family saw it coming. The cause? Daily NSAIDs combined with an aging cardiovascular system. NSAIDs can elevate blood pressure subtly but persistently, cause water and salt retention that stresses the heart, worsen kidney function, which further damages your cardiovascular system, and interfere with medications like diuretics or ACE inhibitors. For a healthy 30-year-old, these risks are small. For someone over 60, they become deadly over time. Just because you've always taken something doesn't mean it's still safe. Your body changes with age, so should your approach to pain relief. There are safer alternatives: topical treatments, physical therapy, guided movement therapy, turmeric-based supplements, or prescription options with lower cardiovascular risk. You should also ask your doctor about monitored NSAID use with periodic blood pressure and kidney function checks. Step 1 is awareness. Step 2 is action. NSAIDs are not inherently evil, but for seniors, especially those with high blood pressure, heart disease, or compromised kidney function, they require extra care. As we age, pain may become more familiar, but the way we treat it must evolve. And let's not forget, long-term use of NSAIDs can also contribute to gastrointestinal bleeding, especially in the elderly whose stomach lining is more vulnerable. Robert's story isn't rare. In fact, 1 in 5 hospitalizations due to adverse drug reactions in seniors is linked to medications like NSAIDs. It's a reminder that even the most familiar remedies carry weighty consequences if not reviewed periodically. Another concern often overlooked is the compounding effect of combining NSAIDs with other over-the-counter medications that may also contain them, like cold or flu pills. For elderly individuals managing multiple prescriptions, accidental overdosing on NSAIDs isn't just possible, it's common. Always read labels, always double-check. Next, let's talk about a diabetes medication with a name as complex as its consequences. Thiazylated urines are known as TZDs. One common brand, pioglitazone. These drugs are meant to help with blood sugar control and type 2 diabetes, but the price they demand from your heart can be devastating. Let me introduce you to Angela, a 71-year-old grandmother living in Florida. She'd been on pioglitazone for 2 years. when her ankles began swelling. Her doctor thought it was just age, but when her shortness of breath worsened, we found fluid had built up around her heart. She was in congestive heart failure, a common but underdiagnosed side effect of TZDs. These pills can cause the body to retain fluid, leading to swelling, edema, trigger or worsen congestive heart failure, and mask the early warning signs of heart issues like fatigue or breathlessness. For seniors already at risk of heart disease, the addition of a fluid-retaining medication is like adding fuel to a smoldering fire. What's more, TZs have also been shown in some studies to increase fracture risk in older women and impair exercise capacity in those with borderline heart health. That means less mobility, more fatigue, and a faster decline in independence. Sometimes the medicine helping one part of your body is quietly hurting another. That's why elderly wisdom isn't just about experience. It's about listening to your body's whispers before they become screams. Always consult your healthcare provider if you notice swelling, weight gain, shortness of breath, or increased tiredness while on a diabetes medication. Ask about alternatives that don't burden the cardiovascular system. Your heart and your blood sugar both deserve care, not competition. Vision loss paired with cardiovascular stress creates a dangerous cycle that reduces independence and increases fall risk. Angela's story highlights this exact cascade. Fluid buildup in her legs was just the surface. What followed was restricted mobility, loss of vision sharpness, and emotional strain. For seniors managing multiple conditions, the burden compounds fast. Finally, we turn to a category of medication many seniors use in search of rest and peace. Sedative hypnotics like Zolpidem, Ambien or diazepam, Valium are commonly used sleep aids. But what they don't know is that these pills can put their hearts in danger. Take Michael, a 79-year-old retired teacher. He relied on sleeping pills for over a decade. What started as a solution for occasional sleeplessness evolved into nightly dependence. He experienced fatigue, memory fog, occasional daytime dizziness, and eventually episodes of irregular heartbeat. These drugs depress the central nervous system, slowing heart rate and breathing. They increase the risk of sleep apnea, a condition that places massive strain on the heart. They can interfere with other medications like beta blocks or anticoagulants, diminishing their effectiveness. They also raise the risk of nighttime falls, confusion, and sudden oxygen drops. Add age, kidney, and liver decline, and you've got a formula for hidden cardiac stress. Inspiration. True rest doesn't always come in a pill. Sometimes it comes from healing your sleep environment, calming your mind, and finding peace in routine. Natural sleep strategies work better long-term. Melatonin, magnesium, valerian root, consistent bedtime hours, calming routines, reducing screen time before bed, and even maintaining daily exposure to sunlight. Sleep quality can be improved without putting the heart at risk. These life lessons from the elderly teach us that comfort is not always about sedation. It's about safety, rhythm, and inner peace. But there's more. Seniors who rely on sleeping pills often experience reduced deep sleep, the kind that helps regulate hormones and repair tissues. Without this critical phase of sleep, the heart doesn't get the nightly recovery it needs. In addition, long-term use of sedatives has been linked to increased risk of dementia, depression, and cognitive decline. Factors that not only affect the brain but place further burden on cardiovascular health. When memory starts slipping and motivation declines, seniors move less, eat poorly, and isolate themselves. Michael's case revealed that after a decade of sedative use, his resting heart rate had dropped to dangerous levels, and his breathing was shallow even during the day. His recovery only began when the medication was slowly withdrawn under guidance and replaced with a robust sleep hygiene plan. Now that we've explored the first 3 hidden heart risks in the previous part, it's time to go deeper. In this section, we'll expose 3 more medications that, while seemingly harmless or even essential, may silently damage the senior heart over time. Let's begin with a medication many older adults take for emotional balance. Let's talk about tricyclic antidepressants. Medications like amitriptyline or nortriptyline. These drugs were once the gold standard for managing depression, anxiety, and even chronic pain. But their impact on the cardiovascular system, particularly in seniors, can be devastating. They can cause blood pressure swings, irregular heart rhythms, and a condition known as heart block, where the electrical signals controlling your heart are disrupted. For someone with a heart already weakened by age, this can be catastrophic. Consider Patricia, a 78-year-old widow from Arizona. She started taking amitriptyline for nerve pain after a shingles outbreak. Weeks later, she began feeling dizzy every time she stood up. One night she fainted in the bathroom, fracturing her hip. Tests revealed her heart was slowing down unexpectedly, a side effect of her medication. It had subtly interfered with her cardiac conduction system. What's even more concerning is how easily symptoms like fatigue or disorientation in older adults are dismissed as just aging, when they might be signs of medication-induced decline. Tricyclic antidepressants can also lead to blurred vision, urinary retention, and cognitive issues, a dangerous mix for seniors already vulnerable to falls or mental fog. Emotional pain deserves compassion, but the solution should never trade one problem for another. Depression and anxiety can be treated in ways that are safer for the aging body. Tricyclics may be effective, but for older adults, newer antidepressants like SSRIs tend to be gentler on the heart. If you're on an older antidepressant and experience palpitations, dizziness, or blurred vision, consult your doctor immediately. Patricia's case underscores a larger truth, that emotional wellness in older age must go hand in hand with cardiac safety. No senior should ever be left choosing between peace of mind and peace of heart. Furthermore, combining tricyclics with other common medications like anticholinergics or beta blockers may amplify these cardiac side effects. Always disclose your full medication list to your provider. Remember, just because a medication helped when you were younger doesn't mean it's suitable today. Elderly hearts require gentler care. Next, let's examine a type of medication almost every household keeps, especially during allergy or cold seasons. Decongestants. Drugs like pseudoephedrine or phenylephrine are often found in cold, flu, or allergy medications. They're praised for how quickly they relieve sinus pressure or nasal congestion, but what they're doing internally can be dangerously overlooked. These medications work by narrowing blood vessels, which reduces swelling in nasal passages, but they don't just affect your nose. They constrict vessels throughout your entire body, including those leading to your heart. This raises blood pressure and increases your heart's workload. Think about Tom, a 76-year-old man from Pennsylvania. Every spring his allergies flared, so he took over-the-counter decongestants almost daily. Over the years, his blood pressure crept up. He was irritable, lightheaded, and occasionally felt his heart racing, but he never suspected his cold meds were to blame, until a routine checkup revealed he was entering early-stage hypertension. What's worse, pseudoephedrine can interact with other heart medications and reduce their effectiveness. It can also increase the risk of stroke or heart attack in those already dealing with hypertension. Many cold medications sold today contain hidden stimulants, which can push an age changes the way your body handles medications. What felt harmless in your 40s can become hazardous in your 70s. Seniors need to be especially cautious with medications that raise blood pressure or stimulate the nervous system. Instead of reaching for decongestants every time congestion strikes, consider saline nasal sprays, humidifiers, or antihistamines that don't raise blood pressure. Avoid multi-symptom cold medicines unless specifically prescribed. For those with heart conditions, simple home remedies, hydration, steam inhalation, herbal teas like ginger or peppermint can be much safer. Another key point, decongestants may also disrupt sleep and increase anxiety, two factors that independently strain the heart. Tom's daily use may have felt routine, but over time, it pushed his cardiovascular system into dangerous territory. Don't let convenience override caution. Lastly, in this part, let's look at a medication millions of seniors rely on to manage digestive issues. Proton pump inhibitors, commonly known as PPIs. These include drugs like omeprazole, Prilosec, or pantoprazole, Protolect, taken to treat acid reflux or chronic heartburn. They're often prescribed for weeks, but seniors end up taking them for years. Here's the danger. Stomach acid plays a crucial role in absorbing key nutrients like magnesium, calcium, and vitamin B12. Without those nutrients, seniors are at higher risk for osteoporosis, fatigue, and most importantly, irregular heart rhythms. Let's meet Eleanor, a 75-year-old from Oregon, who took PPIs for years to manage GERD. She was active and sharp until she began feeling unusually tired and occasionally short of breath. Blood work showed she had critically low magnesium levels, a direct result of long-term PPI use. Her low magnesium led to abnormal EKG readings, a weakened heart rhythm, and multiple ER visits. Worse still, PPIs can also disrupt gut bacteria, contributing to inflammation and increasing the risk of heart disease. There's growing evidence that long-term PPI use may increase the risk of kidney disease and even dementia, both of which can further complicate cardiovascular care in the elderly. Relief from heartburn should never come at the cost of your heart's rhythm. These medications can be helpful, but only short-term and under supervision. Eleanor's story teaches us that even medications prescribed for seemingly unrelated issues can ripple into major cardiac consequences. If you've been on a PPI for longer than a few weeks, especially after age 60, talk to your doctor about tapering off or switching to lifestyle changes like smaller meals, elevated sleeping positions, or avoiding trigger foods. Consider alternatives like H2 blockers or antacids, but only with medical guidance. Also ask for regular blood tests to check your magnesium, calcium, and B12 levels. A balanced gut, proper nutrient absorption, and strong bones all support a strong heart. The key lesson here: just because you feel relief doesn't mean your body is safe. Silent deficiencies take time to show up, but once they do, the damage can be extensive. Now we come to the final chapter, the pill that for millions of seniors is prescribed with good intentions, but may quietly be doing the most harm to your heart. This isn't fear-mongering. It's the voice of experience speaking after more than 30 years of open heart surgeries and countless stories of quiet suffering. Many older adults walk into clinics reporting shortness of breath, fatigue, swelling, or just a feeling that something isn't right. What's alarming is that in far too many of those cases, the culprit isn't a disease. It's a drug they've been faithfully taking for years. That medication is a class of drugs called calcium channel blockers, CCBs, prescribed for high blood pressure, chest pain, and arrhythmias. These drugs are trusted and widely used, but especially in their older forms like verapamil and diltiazem, CCBs can pose hidden risks to seniors. They work by preventing calcium from entering the cells of the heart and blood vessels. While this helps reduce blood pressure and regulate rhythm, it can also lead to bradycardia, an abnormally slow heart rate, and disrupt the heart's natural electrical signaling. In an aging heart, which may already have some decline in conduction ability, that gentle slowdown becomes a dangerous suppression. Take Raymond, 81, from Minnesota. He was healthy, walking his golden retriever each morning, gardening with his wife. 5 years ago, his doctor prescribed verapamil to manage his mild hypertension. Slowly, he noticed changes. He was breathless going upstairs, had mild swelling in his feet by noon, and once even fainted while tending to the mailbox. He chalked it up to aging, but a checkup revealed his heart rate was just 38 beats per minute. Dangerously low, his harmless blood pressure pill had been suffocating his heart's rhythm for years. What makes this so dangerous is how easily the symptoms blend with what we think of as normal aging. Slowness, tiredness, fogginess, unsteady walking. These aren't always just signs of getting older. Sometimes they're warnings, and the longer we ignore them, the more silent damage accumulates. CCBs, especially the older generations, can also cause fluid retention, leading to swollen legs, weight gain, and added strain on the heart. There's also the issue of drug interactions. Seniors are typically prescribed multiple medications. Verapamil and diltiazem in particular interact with beta blockers, which can compound the bradycardia, digoxin, raising risk of toxicity, and certain statins, increasing risk of muscle damage. These interactions may not show up right away, but quietly erode health over months or years. This polypharmacy problem is one of the biggest unspoken risks for older adults. Even a perfectly dosed heart medication can become harmful when stacked with others that compete for the same metabolic pathways. These heart-slowing effects don't always trigger alarms at first. They may appear gradually. A few skipped beats here, a little fatigue there, perhaps a sense of fogginess that builds over months. But for seniors, especially those over 70, even small changes in heart rate or rhythm can tip the balance. The heart doesn't have the same reserve capacity it did in your 40s or 50s. And when calcium channel blockers suppress its activity just a little too much, the whole system begins to strain. This can lead to reduced oxygen delivery to muscles, impaired brain function, even fainting spells, often blamed on a bad day or skipped meal. When the real culprit is pharmacological, aging gracefully doesn't mean accepting unexplained weakness. It means demanding clarity and care that match your stage of life. If you've been on calcium channel blockers for years and feel more sluggish, more swollen, or less you than you used to be, speak up. Ask your doctor if it's time for a medication review. There are newer options, like amlodipine, which may carry fewer risks, or entirely different classes that might suit your condition better. We must also consider how common these prescriptions are. It's estimated that nearly 20% of Americans over 65 take some form of calcium channel blocker. The problem isn't that these medications are inherently bad. They can be life-saving, But without regular monitoring, especially of pulse, blood pressure trends, kidney function and symptoms like edema or fatigue, they can tip the balance from helpful to harmful. And many seniors, particularly those in rural areas or without a strong support system, don't get that close medical follow-up. Let's revisit Raymond. After his heart episode, he was switched to a different medication and fitted with a pacemaker to stabilize his rhythm. Today, he's back to morning walks, back to pruning his roses, and back to being the man his grandchildren chase through the backyard. His story isn't rare. It's a warning and a hope. Across all three parts of this journey, we've uncovered a pattern, a quiet, persistent danger hiding in medicine cabinets and pill organizers across the country. Each of the 7 medications we discussed holds a particular risk for the aging heart. From NSAIDs like ibuprofen and naproxen, which quietly raise blood pressure and damage the kidneys, to thiolidine-diones, used in diabetes care that retain fluid and burden the heart, the common thread is silent harm. Sleeping aids, often turned to in desperation for rest, suppress the natural rhythms of the heart and breathing, while older antidepressants such as tricyclics can interfere with the heart's electrical signaling, adding unpredictable risks. Decongestions, sold over the counter and taken without second thought, constrict vessels and elevate blood pressure beyond safe limits. Proton pump inhibitors may seem unrelated to heart health, but over time they rob the body of vital nutrients like magnesium, weakening muscle function, including the heart. And finally, calcium channel blockers. The focus of today's part, slow the heart to a dangerous pace when used without proper oversight. Each one, in its own way, can be a ticking clock. And for seniors, that clock is ticking louder. What should you do now? Don't panic, but do act. Bring this list to your doctor. Ask questions. Keep track of how you feel. Encourage your loved ones to do the same. Our healthcare system is busy, but your life deserves attention. Medication reviews, even once a year, could prevent years of suffering. This is about more than pills. It's about preserving your independence, your clarity, your connection to life. Elderly reflections, senior wisdom, and life lessons from the elderly teach us this. The heart you care for today will carry you through every memory tomorrow. Protect it, honor it, fight for it. And remember, no medication should ever rob you of the very life it was meant to preserve. Before you go, let me ask, where in the world are you watching this from? Whether you're tuning in from a cozy home in Florida or a quiet village in Oregon, your voice and your health matter. Share your city or country in the comments below. Let's see how far our community of senior wisdom reaches. If this video helped you reflect, gave you clarity, or reminded you of someone you love, please take a second to hit the like button. It helps this message reach more people who might need it. And if you want more stories, insights, and life lessons from the elderly and for the elderly, don't forget to subscribe.